Hello everyone, my name is Jennifer Espinosa and I have been a nurse for 15 years and have worked in several different patient care settings from the hospital to outpatient centers. Throughout the years, I have worked with many different nurses and have seen what can happen when a fellow nurse does not take the time to care for themselves. Compassion fatigue is a real issue within the nursing community that can be addressed by nurse leadership staff members. Today, I want to welcome you to my leadership conference presentation on compassion fatigue in the nursing culture. As nurses, compassion is a trait that is necessary to deliver quality patient care. According to a study done by the Medicine Journal, compassion fatigue is the progressive and cumulative outcome of prolonged, continuous, and intense contact with patients, self-utilization, and exposure to multidimensional stress, leading to compassion discomfort that exceeds a nurse's endurance levels. In short, this means that nurses are continually giving of themselves and not investing any time to regain that energy. This, unfortunately, can lead to physical, social, emotional, spiritual, and intellectual changes in a nurse. These changes can negatively affect patient care. Ultimately, burnout can occur if compassion fatigue is not dealt with appropriately. Consequently, some nurses may even need to take a leave of absence or, sadly, leave the profession of nursing altogether. Nurses are at a high risk for developing compassion fatigue because we are always giving of ourselves to provide care, comfort, and support to our patients. Nursing leadership needs to be ready to help nurses who are suffering from compassion fatigue. Understanding the signs and symptoms of compassion fatigue, ways to prevent it from happening, and helping to deal with it are all crucial. Some signs of compassion fatigue, according to the Journal of Nursing Management, are disengagement, poor morale, physical and emotional distress, absenteeism and tardiness, and high turnover among nurses. These issues can affect the unit as a whole, especially the patients being cared for. When these signs are evident in nursing staff, nurse managers must step in and help the fellow nurses who are suffering from this problem. By being proactive about compassion fatigue, nurse managers can help prevent it before it becomes a bigger issue. As nurse leaders, it's important to know when oneself or another nurse is suffering from compassion fatigue so that we are better able to help each other and prevent burnout. According to the Journal of Nurse Management, managers can help nurses utilize a timeout to allow nurses to step away from the unit and refocus themselves, especially after a very traumatic or stressful situation like a patient's death. A timeout allows for a nurse to recollect their thoughts and get a small break to regain their energy. Nurse managers can also help to promote self-care activities such as physical exercise, massages, going for a walk outside, and even meditation exercises. Other solutions nurse managers can utilize that can help compassion fatigue are open communication with employees and promoting de-stressing techniques such as breath work. It's essential for nurse managers to know the different ways they can help their fellow nurses on the unit to support them and give them a sense of comfort, knowing that they're able to openly and honestly communicate about this issue. So, in conclusion, nursing leadership is very important in making the workplace better for nurses. Nurse managers have an important role to not only help those nurses suffering from compassion fatigue, but also promote a caring environment for patients on the unit. Compassion fatigue can happen to anyone at any time, so understanding what signs to look for and how to help is vital. By providing support and promoting strategies that help defend against compassion fatigue, nurse managers can change the culture for nurses. When nurses have compassion while caring for patients, they are better able to care for them and their families, which positively affects patient outcomes overall. Thank you all so much for attending my presentation on compassion fatigue, and I hope you all enjoyed it and learned a little bit more about this very crucial, important topic. Thank you so much. Goodbye.